The very first people in the Bay Area expected to get the Pfizer vaccine is Dr. Peter Chin Hong. He's an infectious disease specialist at UCSF. Dr. Chin Hong has been treating COVID patients since March, and he joins us now. Nice to have you back on the program, Doctor.
Thanks for having me on, Raj.
UCSF is one of 7 California hospitals that will get this vaccine. Is your hospital ready in terms of just the logistics of all of this?
Well, I think a lot of people have been working very hard behind the scenes, Raj. That means getting those freezers lined up, getting the information technology systems lined up. Again, you have to keep track of the people who get the vaccine and the second shot, getting the vials, the syringes, and the manpower to immunize a lot of people at the same time.
And Doctor, you expect to get this vaccine as early as next week. What's the process here? Will you just sit down like your normal flu vaccine? What do you expect to go through?
I think first of all, the vaccine is treated like a controlled substance because of the security around it. We will be notified randomly within our group who is in line to get the vaccine, and then we'll get the instructions. A lot of information is known even to us, just given the high security aspect around it. And there's some equity around it as well, so that, just because you're more senior doesn't mean you're going to get it first.
Dr. Chin Hong, you bring up that priority list, and aside from the healthcare workers and the people in nursing homes, then it becomes not necessarily a free-for-all, but a lot of people will be lobbying to move up on that priority list. On paper, it'll be done correctly, but will there be some opportunity for VIPs here to kind of sneak in or game the system?
I think that's always a possibility, Raj, but for right now, people are trying hard not to have that happen. And again, I think even in the hospital, which is going to be a model for hopefully how it's going to be distributed, it's completely random by group. So once you get in a priority group, that order within the group is not really known even to us. So let's see how that goes, and let's talk again to make sure that it remains as equitable as possible.
Dr. Chin Hong, we've been doing this for about 8 or 9 months together. How reassuring, how excited are you that we are at this point? We've been talking about it for so long.
I'm so excited, Raj. But again, it doesn't mean that we'll be throwing away the masks, not washing our hands, and huddling together and hugging. With that said, it is the light. It is that trophy that's taking me through these dark times, through this dark winter that we're going through right now.
Well, we appreciate what you've done for all your patients there around the Bay Area and for your contributions here on NBC. Thank you, Doctor.
Thanks so much, Raj.